Good afternoon. Welcome to Idea Innovation LLC, where we make cancer care accessible. So my name is Shelby. I'm the CEO. Um, I am the Director of Operations and Executive Manager, helping to oversee outreach programs and communications, physician services, and working with the community, to provide better health care. Yusuf, um, would you like to describe yourself just a little bit?
Yes, thank you. I am Yusuf Hindi, and I work with clinical and provider services to connect with clinical support throughout the community.
And I'm the cancer navigator. I'm Griffin Marchese, by the way, the cancer navigator. And my role is to be the primary go-to person that helps navigate through the complex journey of cancer treatment, manage cell center or call center and referral of services, as well as manage patient appointments.
And I'm Zoe Harrington. I'm the care coordinator and resource manager. I help establish patients' resources to help pay for care and connect patients with insurance companies to help with the financial burdens of transportation. And I connect them with outside resources.
Thank you guys for that. Let's see. So there are a lot of barriers to accessing cancer treatment. Many people, when they get diagnosed with cancer, they have a huge fear of many things. Has one of the highest mortality rates and is known to be very expensive and time consuming. So there are many financial constraints, because of how expensive the treatment is, and a lot of people in the community do not have insurance, which makes the treatment even more costly. Geographic location also is a problem. Many people do not have transportation, therefore they can't get to their appointments, which leads them to not be able to get their treatment, which can lead to higher mortality rates. Again, like I said, transportation challenges. Um, it does make it difficult, and there's a lot of cost with trying to get Ubers or Lyfts or trying to get friends to drive them to their appointments. And then especially if you live in rural areas, that is an even bigger problem. There's also the emotional burden. With a cancer diagnosis, many patients become depressed, and rightfully so. It's very scary for them. So being able to have an outlet where they can talk about what's going on is really important. And then healthcare literacy, many people don't fully understand what they're going through. Sometimes doctors, when they talk to their patients, they use words that most of the population does not understand. And so it's really important to have someone like a navigator that's there to help explain what maybe the doctor explained, but to an easier level.
So our firm's mission, we are striving to create a healthcare access and lessen the cost burden for cancer patients within our community. Many of our patients lack reliable transportation, are under or uninsured, and many work only to part-time jobs, making it difficult to access and receive care. By doing this, our firm wants to create a equal access by providing them with resources such as transportation, setting them up with a foundation that can assist them with applying for financial assistance, such as payment plans or a free drug program. This can be done by setting up them with social workers in their area if they choose, or set them up with our partner foundation. We also strive to do this by making sure that we set them up with a care coordinator to help them keep up with their appointments. For example, each appointment that they check in will have their provider's care coordinator and be the sole source of an appointment information. Our problem statement and our plan of action for many people, they fear cancer, and it is one of the highest mortality rates and is known to be
Oh,
expensive and time consuming. Many patients must go to appointments regularly and see the provider. This is not always possible for patients who have limited transportation and or lack of access to funds to pay for treatment. So when patients cannot get their appointments or they cannot afford it, many become lost to follow up and do not end up receiving life-saving care.
Yusuf.
Thank you. Thank you, Griffith. My name is Yusuf Hindi, and as mentioned, I'll be talking about our clinical outreach. We look to provide accessibility for our patients by providing reliable means of transportation to ensure the access to care. As you can as we mentioned, transportation is our biggest obstacle to routine and cohesive and continuous care. We'll start with accessible in-home and also telehealth options for patients who are farther out of geographical area by having technology and innovation to help provide ways to access care when geography is an issue. We will be working with a community of physicians and care coordination, also in home nursing care and also at home clinicians, such as infusions, such as physical therapy, and other kinds of therapy to provide care at home when access and transportation is an obstacle that can be overcome. We will also provide personalized care in the form of care coordination and someone who will help patients navigate to make their appointments, to provide transportation when necessary, and also to provide other options when there are better options that can overcome transportation barriers. So through these three aspects, we will improve healthcare access and reduce financial burdens to our cancer patients. So we will improve our transportation costs as well. This is obviously other than availability, one of the biggest obstacles. We will, with our care coordinators and our navigators, we will identify transportation barriers that are unique to every individual. We will work with those individuals to help find a network of transportation support in the community. We will also measure our impact by measuring how often our patients utilize our services and how often we are successful at making patients succeed in making their appointments and also for their cancer treatments and other necessary transportation outcomes. Finally, we'll work with our community, as we mentioned, for transportation support. We have support in the local community in the form of transportation services that we will contract with, and we will be working with them closely to meet these needs also at an affordable level for our patients and our physicians and providers. Thank you.
Thank you, Yusuf. And now Zoe will give us a little bit more information on what we do.
Patients living in rural areas without access to public transportation face significant financial burdens and delays in care. For these patients, the utilization of skilled in-home care and telehealth visits when available will reduce unnecessary trips. This will help prevent missed appointments and delays in care as well, mitigating costs associated with travel and allowing for improved health outcomes in patients living in rural areas. To do so, we'll offer telehealth visits and provide community-based point of care by minimizing the need for long-distance travel by the patient or the physician. And we will create a telehealth division that helps provide people with technical support for the patient and the doctors by assisting with virtual software and scheduling. And lastly, I'll talk about our care coordinators. Patients diagnosed with cancer are not only under immense stress navigating their diagnoses, but also must face costs associated with travel, treatments, and medications. Healthcare literacy places yet another constraint on these patients due to the complexity of cancer treatments, medical jargon, and healthcare systems themselves. Because of this, many patients become overwhelmed and may be reluctant to continue with treatment. To alleviate this, patients will be assigned to a care coordinator who has been trained specifically in assisting patients with navigating cancer treatment, thus preventing delays in care and allowing them to better understand treatment options and options for financial assistance. Care coordinators will assist patients in setting up appointments, travel arrangements to appointments, and understanding treatment options and costs associated with treatment options. They will also assist in connecting patients with options for financial assistance, including payment plans, free or low-cost drug programs, and partner foundations. Lastly, care coordinators will give patients resources for mental health care. Patients diagnosed with cancer often experience depression, anxiety, and worsening of symptoms of pre-existing psychological conditions. Having care coordinators connect patients with resources for their mental health will improve overall health outcomes in patients by preventing declines in physical symptoms due to changes in their mental health and will help patients better navigate treatment plans.
Thank you so much, Zoe and Griffin and Yusuf, for that wonderful information. So in conclusion, our firm is very dedicated to transforming the care for cancer patients by addressing the key barriers for transportation, financial challenges, and healthcare literacy. We're currently aiming to build a really strong support system with improved transportation and home care, telehealth visits, and hiring more dedicated care coordinators to guide our patients through their treatments. Through the strategic partnerships in our community and being more engaged, we will enhance healthcare access and improve the outcomes and hopefully lessen the mortality rates and ensure that all patients receive timely, effective care, regardless of their circumstances. Thank you guys so much.